Okay, finally, our last kind of product testimonial. We're going to go down to Austin to Dr. Dan McGrath. Dr. Dan McGrath, you are a hair restoration specialist, and really appreciate you sharing on here. And you've kind of got some interesting thoughts on the Renew 28 and what you've been experiencing in your own practice. So thank you for joining us here tonight. And, yeah, share what your experience has been.
Sure. Well, thank you very much for having me. And I'm relatively new to the ASEA family. This was introduced to me a couple of months ago. And as a physician and a surgeon, I immediately saw that it could have an application for my patients. Anything that can help to speed up wound repair and improve tissue viability. And even there's an application for improving the growth of hair, which was very interesting to me. And so I embraced it immediately for that reason, but then came to realize that it was much, much more than that, diving into the science of it and trying to learn as much as I could about redox signaling molecules. It really opened my eyes, and I started using the product as well as the gel personally. And I, of course, like everyone else, everyone I've talked to that's given the product a try, they've seen some sort of benefit. I also had dealt with a lot of, aches and pains from, challenges over the years. And I wake up every morning now and I pop right out of bed and I feel fantastic. And that's just with the 4 ounces twice a day. I recently, as I said, had been using this on my patients. And I decided to change my entire post-surgical protocol to where I would use the ASEA gel in the area where we would harvest tissue. There would typically be an incision, and those incisions typically take 10 to 14 days to heal to where they're stable enough to where we can remove the sutures safely. And I decided to use this with my patients, and on one of them, it just so happened that he was from the Dallas area. And he was running a little bit low. I'd given him a sample bottle, and he had his surgery on a Monday, and then contacted me on Wednesday and said he was running a little low. Could I get him some more? I apologized because I did have some, but he would have had to come, to my office, which meant a 3.5-hour drive for him. He said, "I'm fine. I'm happy to do it." So he drove from Dallas back to Austin the next day, which is Thursday. So now he had surgery on Monday, and now it's Thursday. This is post-op day number 4. And I brought him in, and my intention was to just document and look at the incision, maybe take some photos, see how if it's improving. And much to my shock, as well as my nurse who was with me, we both were looking at each other. We couldn't believe what we were seeing. But in 4 days, his incision was completely healed. Now, in 18 years of doing this work, I've never seen that. I would never have dreamt that I would be removing sutures from this procedure on day 4 post-operatively, but that's what we did. And he healed up beautifully. So I know that this is something that's dramatic. I've seen it with my own 2 eyes. And as you know, Alan, I provided you with another case, which I think even is more dramatic. This young lady came to see me earlier this week on Monday. And unfortunately, this young lady is the victim of a cosmetic procedure that didn't go so well. She was getting ready to have her prom, which is coming up this Saturday. So she went in to get a chemical peel done in the hopes of maybe improving her complexion and looking a little nicer for the prom. And what she got was a profound inflammatory reaction. So what you're looking at on the picture there is what we call in the industry, it's very, very straightforward. She basically got a burn, and what she has is called post-inflammatory hyperpigmentation. Now, she's Hispanic. She's got a little darker skin tone. The normal healing time for something like this, we're looking at minimum weeks to months before that goes away. And of course, being the medical director for this facility that treated her, I had to bring her in and I had to work with her. And I told her mother, you know what, I have something for you. Come in and let's give this a try. And so we brought her in on Monday, and we gave her the gel to use twice a day. And this picture you see now on the right-hand side is a picture of her today. Today was Thursday, and I got her in, and that is just 3 days of using the gel, and her face is practically completely clear. She is in perfect condition to be able to attend her prom night, and she was literally in tears today because she thought that she was going to miss out on a very important event in her life. But what was even more important to me is how profoundly thankful her mother was that we had something that could work.
Yeah.
Now, again, being new to the product, I was sure hoping that we would get some improvement, but I had no idea that we would get as much as we did. Now, as I said, I'm new, but you know what? I really believe that this is a product that not only is going to change lives, but it's going to change the way we approach many various aspects of medical therapy as well as surgical therapy. So anyone who's out there listening, you better pay attention to this, because this is going to become a common household name in the next few months to a year. And this is going to be as popular as Facebook. You mark my words.
Love it. Love it. Dr. McGrath, thank you so much for coming on tonight and sharing. Really, really appreciate it.
My pleasure. And I'm happy to do it. And I'm happy that this can be something that can help as many people as we think it can.
Cool. Thank you so much. Thank you. So guys, just let me make it clear before we move on to the last part of our call here tonight. Again, I said at the beginning, but guys, these are powerful testimonials. I want to make it clear. Our products, the ASEA Redox, Renew 28, any of our products, they are not designed to treat or cure any disease or medical condition. We're simply feeding the body. For the first time in the history of mankind, we can supplement more of these powerful redox signaling molecules. We can improve the signaling and communication and the cellular function of our bodies. And it's amazing what our bodies can do with that. Everything you're seeing here, everything you've heard here today is the body simply really firing up its own natural healing processes, because now it has enough, a plentiful supply of these powerful redox signaling molecules. So thank you again, everybody that joined us, Dr. McGrath, Tom Beasley, and Ashley Ulray. Thank you so much for sharing your stories.